about abnormal uterine bleeding. Well, it occurs when you bleed outside of your normal monthly period. You might hear it called anovulatory bleeding. Your flow could also be heavier or last longer than what is typical. When it comes to menstrual cycles, there is a wide range of normal, but your period shouldn't be a problem for you month after month. If it is so heavy or unpredictable that it keeps you from doing some activities or makes you miss work or school, you may have a medical condition that should be treated. Earlier on this channel, I have already posted a short video about abnormal uterine bleeding. I hope you have already seen that. And today I am going to discuss this problem in detail. Well, first of all, I should tell you the symptoms of abnormal uterine bleeding. Well, the signs and symptoms of abnormal uterine bleeding include heavy period, that is also known as menorrhagia in our medical terminology. And another symptom could be bleeding between your periods. It can be after sex or during menopause. Your periods can be long, more than 7 days. The periods can be irregular. Okay. When usually patients come to us, we ask a certain question to make sure, the diagnosis about abnormal uterine bleeding is correct, and because there are different conditions that cause it. So we ask question regarding this. And the first question is, how often you get your period? It should be fairly regular. The length of each cycle shouldn't change by more than a week. If it is shorter than 3 weeks or longer than 5 weeks, that could be a sign of a problem. The next question we ask usually is how long it lasts. A typical period lasts 4 or 5 days. If yours is often less than 2 days or longer than a week, that could mean something is wrong. And the next question we ask is that how heavy is your period? Most women only lose about 2 tablespoons of blood each period. More than 5 tablespoons is thought to be unusually heavy, but that is hard to judge. You should let your doctor know if you need more than 1 tampon or pad in an hour. Abnormal heavy menstrual bleeding is called menorrhagia, that I already told you. Okay. Then the next question we usually ask is whether you have spotting between periods, and then also we ask whether you have bleeding after sex. If you could be pregnant or you have passed menopause and have any kind of bleeding, you should call your doctor. Some spotting is common early in pregnancy, but bleeding can be a sign of serious condition called an ectopic pregnancy. That is when a fertilized egg implants somewhere outside your uterus, most commonly in a fallopian tube. It could also mean you are having a miscarriage. Well, after menopause, women who take hormone replacement therapy may still have period, but any bleeding should be checked out. Okay. Now I will tell you the causes of abnormal uterine bleeding. There are a few possible causes behind abnormal uterine bleeding. These are hormonal changes. Problem with your hormones are the most common reason for abnormal uterine bleeding. When one of your ovaries releases an egg, that is called ovulation. Certain hormones tell your body to build up and then shut the lining of your uterus, that is called endometrium. With teenagers and women getting close to menopause, the endometrium can build up too much. That can lead to an irregular or heavy period or spotting between periods. Okay. And then I should tell you that there are certain things that can throw off your hormones too. Birth control pills and other medicine like warfarin and hormone therapy, fast weight loss or gain, emotional or physical stress, and intrauterine device, that is IUD, polycystic ovary syndrome. Okay. And now another reason for abnormal uterine bleeding is that there may be some problems with your uterus. That is another possibility for abnormal bleeding. It's a physical. If there is a physical problem with your uterus, abnormal bleeding can also take place. Millions of women have fibroids, which are non-cancerous tumors that grow in the muscle of the wall of the uterus. A polyp is another kind of growth that can form in the lining of your uterus. A condition called adenomyosis is when the cells similar to the ones that grow in the lining of the uterus start to grow in the muscular part of the uterus. Endometriosis can also cause abnormal bleeding. This is when tissues like the kind that line the inside of uterus grow outside of your uterus. And now I'll tell you some other health conditions that can cause abnormal uterine bleeding. Other health conditions are much less common, but abnormal uterine bleeding can also result from bleeding or clotting disorders or blood thinning medications. Cancer of the cervix, endometrium, or uterus, illnesses that affect your kidneys, liver, thyroid, or adrenal glands can also cause abnormal uterine bleeding. Infections of your cervix or endometrium, and there are sexually transmitted diseases that can also cause abnormal uterine bleeding. And now I'll tell you about abnormal uterine bleeding diagnosis. It can help to take detailed notes over a few cycles so you can give the doctor specific information about your symptom. They will also ask about your overall health and give you a physical exam. You will probably get a pregnancy test, and you may also have blood work. Heavy bleeding can leave your body short of iron. A blood test can see if that is a problem for you. It can also show if your hormones are out of balance or if you have a blood disorder or chronic disease. Ultrasound. This is a very important test that uses sound waves to make images of inside of your uterus so your doctor can look for fibroids or polyps. Earlier on this channel, I have already posted a very informative video about fibroids. You can see that video, okay? Another investigation we can also order is stereoscopy. The doctor will look inside your uterus in this investigation with a tiny lighted scope that they put in through your cervix. Also, sometimes we may order biopsy. In this procedure, the doctor may take out a small piece of tissue and check it under a microscope for abnormal cells. Then in some cases, we may also advise magnetic resonance imaging. This test uses radio waves and powerful magnets to make detailed pictures of your uterus. It is not used that often, but it can help spot adenomyosis. Now I will discuss abnormal uterine bleeding treatment. Your treatment will depend on the cause of the abnormal uterine bleeding. If a chronic illness or blood disorder is at the root of your symptom, treating that can help. Treatment also can depend on whether you plan to have children. It might not be safe to get pregnant after some treatments, while others can make it impossible. If you are close to menopause, the doctor may want to take a wait and see approach because your symptoms may get better on their own. Drugs are usually the first thing your doctor will try. Now I'll tell you about some medications. Hormones. Birth control pills and other hormone treatments may be able to give you regular menstrual cycles and lighter periods. Gonadotropin releasing hormone agonists, that is GnRHa. These medicines stop your body from making. I was telling you about gonadotropin releasing hormones agonist. These medicines stop your body from making certain hormones. They can shrink fibroids for a while, but they are usually used along with other treatments. Then we can also prescribe non-steroidal anti-inflammatory drugs. If you take anti-inflammatory medication like ibuprofen or naproxen a few days before your period starts, they may help lighten the bleeding. Tranexamic acid. This is a pill that helps your blood clot and can control heavy uterine bleeding. IUD. For some women, an IUD that releases a hormone called progestin can stop heavy bleeding. Many women who use one don't get a period at all. Sometimes surgery can be needed to stop the bleeding. In surgical treatment, we may also suggest endometrial ablation. This uses heat, cold, electricity, or a laser to destroy the lining of your uterus. It may end your periods entirely. You probably won't be able to get pregnant after having it done, but it can be dangerous if you do. You will need to use birth control until menopause. Myomectomy or uterine artery embolization. If you have fibroids, the doctor may take them out or cut off the vessels that supply them with blood. Hysterectomy. This is when the doctor removes your uterus. You may need a hysterectomy. If your fibroids are very large or you have endometrial or uterine cancer. Otherwise, it's a last resort when the other treatments have not worked. Now I'll tell you about some complications of abnormal uterine bleeding. Complications that may happen with abnormal uterine bleeding include trouble getting pregnant, anemia or blood loss, there is a higher risk of endometrial cancer. Well, this was my video about abnormal uterine bleeding. I hope you like this video. If you have any question about this, you can post in the comment section, and there are so many medical videos on my channel. If you want me to upload a video for which if you want me to upload a video about an illness, for that video is already not there, you can ask me in the comment section. Thanks for watching this video. See you next video. Bye for now.